Okay, wonderful. I think we're live. Linda, can everyone hear me okay, and can you see my screen okay?
Yeah.
Yes.
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 Oh,
Yes.
okay. Very good. Well, Linda, I'll go ahead and let you start things, kind of introduce what really today's about, and then we'll go from there.
All right. Thank you, Scott. Like I said, maybe you were off the call. You must have got off the call, Scott. We are doing this as more of an informational webinar to educate our clients as well as show you what SAGE has available to help you measure these requirements of the Affordable Care Act and keeping compliant with that. As I mentioned earlier, we do have some of our SAGE consultants on the webinar today, so if you have specific questions that you would like to ask, feel free to do that regarding your solution and what would be available for you. If there's also the chat window that you can send a chat, and I can keep track of questions there. We can ask those of Scott at the end. Scott's informed me that the webinar probably will not go the full hour, so we're good for a little extra time there. And Scott, I think I'll let you go ahead and get started.
All right. Well, wonderful, and thanks for the introduction, Linda. For those of you that weren't on the original webcast we did previously, and just to associate my name with a voice, my name's Scott Pope. I'm a field sales engineer with our SAGE Employer Solutions. Really excited that Tandem has put this together today, for their clients, and just really to talk about these specific topics. So, as I can tell, one of the things that we always like to start off with, for those that may already know or may not know, SAGE, we sell through an authorized business partner channel such as Tandem. So I can't say enough great things about what they do, what great hands you are. Allows us as the software manufacturer, obviously, to do what we need to do, but then you have the experts such as Linda and Al and company to really walk you through your individual needs. You'll hear as a call to action at the end of this, as well as throughout, we're going to be talking about the ACA compliance and the Affordable Care Act and what that means. But also, as a takeaway today, we encourage you, please, after you're done, talk to us, talk to Tandem, reach out to your contacts, and really has that as a takeaway item of today. If you have any further questions or anything that you don't feel like asking in today's webinar. So basically, one of the things we want to talk about also, not only a certified partner and trainer, but we've put together these webinars to go through today's agenda, really to talk about what the ACA is in total, their timeline, what's actually important today. And I find the timing of today very, very unique because if you did read the news, Linda must have known that the Supreme Court was going to come down with their ruling today when she did this. If you did read the news, that the Supreme Court did vote 6-3 to actually confirm the ACA. So it's especially important today. I got a chuckle knowing that today's webinar was going to be on today's date. Obviously, we're going to show you what we're doing to help. I mean, this isn't something that we decided to advance or just pull out of a hat a few days ago. We saw this as a major compliance issue for our clients and our customers and our business partners. And our development process, we started a long time ago, actually putting forth those development efforts. So we're going to talk about why that's important, what we're doing to help, and really what we call that. And our actual tool, you'll hear me refer to this several times today as My Workforce Analyzer, or MWA for short. You might hear me refer to it as that, just to shorten it down. That's our tool that we're going to be talking about, and how that can help you overcome the compliance and the necessary items that you're going to have to be required to do at the end of the time. So a little timeline of what the ACA is and what's going on, and even today did not have a chance to update our slides based on the Supreme Court ruling. The major news blast that I saw came out about, I think, a little after noon Eastern today. But really, as you can see across the screen, something there, in 2010, the ACA, the Affordable Care Act, it goes by several different names, PPACA. It became law. Okay. The Supreme Court affirmed that the law could become a tax. The pay or play was postponed. There was a lot of changes in 2012, 2013. In 2014, as you can see some of the things on the screen as well, we basically had to start monitoring some employees. They had the marketplace open. There were some other challenges. The marketplace, you saw probably a lot of political positioning. That won't be our discussion of today. What we're going to talk about is what is actually going to be real. And so now, under the requirements, in 2015, you are required to track and maintain all of your employee information for the reporting purposes in 2016. So that's what we're going to talk about specifically, what we call the 1094C and the 1095C reports for the actual IRS itself. We'll talk about some other things, where that data comes from, of course, and I'll give you a little background in Sage HRMS. Obviously, that it's not magic, where this actually comes from. Some of the other features of My Workforce Analyzer, why is it important? Why are some of the things that we're going to discuss really important? Obviously, if you're just getting into the door of what you want to offer your employees, or what we call the modeling aspect of it, the cost to pay or play, what kind of fines, if any, or payment penalties are we going to be look at if we choose a certain route. So those are some of the things that we can show and talk about in there. For those of you that probably already have, and I'd say the majority of clients already have an idea of what they want to do, they've probably made those decisions or discussions. That might not be as big of an approach to it, but it's also nice to look back at some of those things and say, okay, yeah, that we did make the right decision, or reassess as you go along. Obviously, who's eligible for the actual benefits that we're going to speak about today, or full-time equivalencies, things like that we'll talk about going through. And then, obviously, the compliance issue of it, reporting when those employees were eligible for, and, the actual reporting purposes to the IRS. We'll talk about that in general as well. So there's a lot of information, a lot of timelines, a lot of dates that are associated with My Workforce Analyzer. Of course, the employer mandate side, as you can see on the screen, it's going to go into effect for employers with 100-plus full-time equivalents, or full-time equivalents, FTEs for short. Basically, as you can see, the FTE employers that are under 99, that it's going to be delayed until 2016, but it's still going to occur. So 50 to 99, that was delayed until 2016, but those, by all accounts, are still going to occur. This is data that absolutely should be tracked moving forward as well. So we'll talk about that as we go through. You also probably heard people refer to the different ACA requirements as 60, 55, 60, 56. Those are the actual sections that the IRS lists the requirements to. So what they call in the 6055 the minimum essential coverage to the IRS notification, and the 6056 is basically, as you can see, requires all the employers over 50 FTEs to report on their coverage that they have. So you have to at least report on that. Basically, as you can see, there's additional penalties applied, and we have a lot of different offerings that we're going to talk about today that you can keep track of some of the different features in the laws as they actually change. So, for instance, our marketing department has done a great job of putting together some flow charts, some items, and even websites out there that you can look through. This is an example of one of our marketing flow charts that just wanted to get to our customer base and tell them what actually they are required to fill in and out based on their employer size, some of the other information, and so on. These are things that, again, part of that 6055, 6056 coverage that again, you can actually go through, talking about the compliance dates and information. I feel like our marketing department did a great job of that, and of course, our business partners such as Tandem are doing that as well. Getting out there, evangelizing that these are things that we want our clients to be prepared for, so they're ahead of the game when it comes through. One of the other questions I also like to ask people, I just attended the APA, American Payroll Association show, as well as the SHRM, the Society for Human Resources show. It's going to be coming up next week. I'll be there. But I like to ask individuals that are walking by, you've heard about these 1094s and these 1095s. Have you actually just taken the time to look at them? And some people say, sure, yeah, Scott, I have. I know what's going to be on there. And others say, honestly, Scott, I really haven't. I know it's a requirement. I keep hearing how bad they are, the different situations with it, but I really haven't taken the time just to pull one up and look at it. The IRS finalized a couple months ago the actual forms that are going to be used. And as you can see on the screen, this is an example of the 1094C form. And one is required for each federal taxable organization or entity. Okay, so this one really, to me, it isn't the most difficult form. I mean, obviously, you're going to have to fill in some information, of course, about your organization, some different coverage levels and those kinds of things. But for one form for each entity, really not that difficult or bad. The one that absolutely where I have sympathy for whoever is in charge of these within your organization is the 1095C. And this is the form that has to be filled out for each and every employee. As you can see at the very top of the screen, we have information about the employee, their social information, some of the demographic information, their employer information, as you can see. And then obviously on part 2, when they were offered coverage and the minimum offerage level for each one. Now, if you're lucky enough to have all of your employees be available for all 12 months, you only have to fill in this 12 months box for each one of them. But unfortunately, that's not a realistic situation for every single client of ours. We have clients that are seasonal. We have clients that might be seeing rapid growth in their organization, so they might have hired a ton of individuals on into the first quarter, those kind of situations. And then also in part 3, as you can see below, this is where you have to list the covered individuals as well. So just taking into account all the different changes, whether an employee's hired and then maybe they bring on their spouse, and then their spouse, they might adopt a child or have birth of a child or change, whatever their dependent changes are. Those are things that have to be reported on this 1095C for each and every employee. So when I first saw this form, this is the one that, as I said, elevated my heart rate a little bit, just knowing all the data that has to be placed on this one form and the individual items and actions of each one. So definitely like to show this to kind of see what we're up against, focus on that, and see that this isn't something that we really took lightly at all, knowing what was going to have to be reported out. So really, let's kind of list out some of the things that we need when we talk about the data. And, to some, this may be a boring list, but it's good to go through and kind of see this. The HR data, of course, date of hire, termination, obviously all the demographic data that we talk about, their birth date, any kind of break-in status, jury duty, FMLA, start and end dates, intermittent FMLA. We have, some payroll data. So how many hours worked and paid? Did they work hours or did they not get paid? Unpaid leave. Okay, any type of pay effective dates, hourly rates of pay. And then most definitely we have to know about our benefit plans. Proof that we had offerings for our employee. We had to see the minimum cost for each plan, their actual enrollment status for those individual dates as we go through. And then, of course, the funding and those dependent enrollments that we talked about in Part 3 of the 1095 form. So quite a bit of data goes into this just for that one particular form to be able to produce those at the end of the year. Okay. Obviously a game changer. This is one of those situations that this has, in my opinion, really elevated the need for HR and HR directors to have those particular areas, HR and payroll, to have this information. Or, again, from a compliance purposes, this could be a really scary sight at the end of the year. So to follow up on the item of what we're doing to help, in association, we have an area out at Sage City that you can discuss this with fellow customers and clients as well as business partners. And we've dedicated 2 sites to specifically this topic. The first one being a website on that middle bullet. It's called sagecanhelp.com. This is where we put up to the minute information. Again, you'll see some of those flow charts, dates, things you need to know about the ever-changing ACA. I'm quite certain our marketing department is probably working on a press release right now to put out there for the newly updated information. And then My Workforce Analyzer, and there's a site called myworkforceanalyzer.com. You can link to that from sagecanhelp.com as well. But this will give you specific information about MWA or My Workforce Analyzer itself. Be able to walk through and find out what's necessary, what's going on with it, some of the different features and functionalities. So we're really excited to talk about that. Also, when we talk about it, as I mentioned before, it was one of those things that Sage really did dedicate the time to seeing this as a compliance issue. It was almost several years ago now where we saw that. We saw that it was a compliance issue, had to develop some development time, work with individuals. We have some of our product managers are, of course, speaking with the IRS on a weekly basis, finding out if there's, what needs to be changed. I even know I was talking to one of them the other day, and there's some safe harbor codes that are being changed. So still things are going on that we're keeping up with and having to absolutely take into consideration in future updates in the products. So we're happy to talk about that. Really that entire workflow information, obviously, of taking that employee info, from the HRMS, bringing that in, monitoring the full-time equivalencies, of course, determining whether you're a large employer, if you're right on that line. Some of you today might be saying, Scott, there's no doubt I'm a large employer. Some of you may be saying, well, I'm not sure. It can honestly change on a day-to-day basis. How do we find out? So those are things that My Workforce Analyzer can, of course, do. Tracking, what they call those measurement periods all the way through, and then, of course, that pay-or-play modeling from the beginning if you wanted to do that, or just double-check on your different numbers. So a little bit about the tool. We're absolutely going to see that today. It basically it's in-house installation with Sage HRMS. It does come, the actual the software license itself, it's free to our existing customers on Gold support. So absolutely what you can do is, if you're a Gold support customer today, you can just simply request that you have a key and you can start configuring it. Tandem is definitely there to assist you in implementation needs and things like that. So if you're interested and you want to discuss more about your specific situation, this is a great time to review. Some of you may feel like you need to review some of your benefit plans and rates and things we'll talk about in just a second. This is where the experts at Tandem are going to help you and guide you through this process to make sure that, hey, do we have these rate tables right? Have we been using this correctly? And train you on this. And, of course, that 1094 and 1095 reporting that we had discussed before. It's basically available for Sage HR and payroll customers or HR-only customers. So as we'll talk about it, there's several different ways you can utilize the data. If you have HR and payroll, you can, of course, use that. If you have HR only, we can also help you import in some of your payroll data if that's needed. So there's some different things. I encourage you, when we get into the technical side of things, encourage you again to reach out to Tandem, speaking around the type of payroll system. If you use an external payroll system or you're concerned about bringing in some payroll data, definitely talk about that. Reach out, and we'd be more than happy to answer those on a case-by-case basis as well. It's good for Sage HRMS and Sage Abra Suite. If you're using the older Abra Suite legacy product, that's definitely we created it for both. So I know that's been a question before in the past. And basically, again, we can reach out for license support and maintenance pricing. If you're not a Gold Care customer today, that's something that your individual reps at Tandem can provide you with. So without further ado, as we're going through, Linda said she's going to be keeping track of some of the questions. Feel free to send her a chat message as we're going along, and we should definitely have time at the end to go through and answer any questions to the best of our abilities. What I'm going to do now is I'm going to switch over to my demonstration environment, and we'll literally go through it. I'll give you a little background on things and how it works for those of you that aren't Sage HR customers today and maybe you're considering it, or maybe, for instance, you are a Sage HRMS customer, but you kind of want to take a deeper dive into how it all works and what's going to go together. So I believe everyone should be able to see my screen here that says, "Welcome to Sage HRMS." Is that correct?
Yes.
Yes.
Wonderful. So this is our core HR module. For those of you that work with HRMS or Aca Suite, this should look pretty familiar right now. As you know, when we go through, one of the main setups that we'll talk about is, of course, your benefit plan. So the very first thing that we want to do is, whether you're an existing HRMS customer or you're considering, wow, how do I get my head wrapped around the compliance for this? The very first thing is just making sure that we have all of your correct insurance plans set up in the system. So whatever your particular plans are, this is just a demonstration system today, so this isn't real live customer data or anything like that, where we aren't making any HIPAA violations. I just have some plans here that I've set up for the practical purposes of today's webinar. And as you can see, it's going to have different structures that we can work through and even open up to a bigger discussion, such as, when is this plan in effect from? What are some of our coverage amounts that we're covering, whether it's a flat dollar amount or, for instance, for this life insurance plan, is it based off of a rate, maybe 2 times an annual salary, those kinds of things. Employee contributions. This is where we can calculate, what is the employee's contribution for each one of these plans. So that's going to go into the factor of what's the cost of coverage, what's the total minimum coverage for each employee. These are all things that we want to factor in. Even for existing HRMS or Aca Suite customers today, we want to make sure that you have everything set up right and that you have all your plans in there. So again, that's why probably a review by your necessary contact at Tandem probably would be a good idea, just to walk through. Have different employee premiums, information, and then we also have eligibility codes. Is this person full-time? Are they salary and hourly? When are they eligible for their actual benefit here? So is it based on an adjusted seniority date, the original hire date? These are all things that the system can help you calculate and really make a difference. Even if it's a custom eligibility, you can write a formula in here to determine, for instance, if the person's a non-smoker. Are they, for instance, are they over the age of 65? Whatever the case is, we can put in different eligibilities in here that will help you make those decisions. And then year over year, we have rate tables that can be set up. So in this particular case, that same rate table, this one's kind of funny. It'll actually calculate, of course, how a spouse on the plan, how many dependent children are on the plan. It puts it in a rate table. And as you can see, this is just a demonstration system because this particular plan, the individual can have up to 99 children, and their rate caps out at $402. But you get the point. Year over year, the rates can be adjusted and transmitted in here. And actually walk through. And as the employee goes through the year, it's going to take into account different things when, of course, dependents are enrolled. We go flip over to the employee side. We can pull up an actual employee's record now. And there's a couple different things that we can do, of course, to help out with these different scenarios. So from a benefits perspective, you might say, okay, yeah, I'm going to keep track of these. The benefit administrator, they can keep track of, what benefits they've applied, what they're currently on. We can add certain benefits, add their dependent and beneficiary information. So again, part 3 of the 1095-C form, this is where it's going to get the data. So, when this particular employee, well, all their information that has to fill out, what their benefit enrollments and beneficiary elections are, okay? We can see those in the system. Okay? It's going to keep track of that information. Some of you might be saying, well, I'd like to help even automate this process. And that's where we also have, products such as Employee Self-Service, which offers the benefit enrollment module in there. So you can have employees connect via a web browser, log into their information, not only do things like change their address, but they can add dependents, choose their plans all online on a web browser. So it gives us a lot of flexibility. Gives us an idea of what's going on. And as you can see, whether they enroll online or you enter them here, it's going to calculate their benefit plans using these plan rules. Okay? For those of you that have used this before, that's what it's for. It's meant to save you time, not have to actually calculate it manually yourself. Obviously, if you have special circumstances, you could always override that. But the point of the matter is, what we want to do is take those calculations, those manual calculations, and take that off the table. So it handles it in here, it stores that information, and keeps track of the entire situation as you go through the year. Even further, for those of you that have payroll, Sage HRMS payroll, you have the ability also to send over that deduction information directly to payroll. So I always like to show this really quickly as well. So, something along the lines where, a deduction is linked to a certain amount of pay by the employee or percentage, 401k, whatever the deduction is. If we give Veronica just a $5 increase, hit apply, it's going to go through, of course, whether you have payroll, you can go through and update the deduction information. It's also, if you don't have payroll, just when the HRMS module, it's going to change, what the employee or employer responsibilities are if it's based on that salary. Okay? Go through and updates all those plans that we talked about. So I'd like to just kind of show that as a background, first of all, so you can kind of see exactly how the setup is for those of you that might have HRMS today, but maybe it's been a while since you've opened up the benefit plans or how they're calculating. And also, for those of you that don't, it's really part of the setup of HRMS. The core HRMS itself, it gives you that ability to track this, and it's not magic. It's literally just being prepared for these reports in the future. That's probably the best thing I can say about it is having the HRMS be prepared, walk through, and be able to calculate and monitor all this data as we go through. Okay. In addition, before we switch over to My Workforce Analyzer, in addition, as you may or may not know, we have the employee benefit reports associated with the core HR as well. So for those of you that are saying, what are some other benefits that we get from HRMS, from having all of our benefit data in here? Well, it's not just that we can generate those forms at the end of the year. One of the reports that we think clients really like to give to their employees is that benefit letter, or what some refer to as that total compensation statement. So very important in today's day and age, especially to say, hey, look what your company, you think you pay a lot for health insurance or for your benefit packages, look what we have to pay. We just want to let you know you're valued. This benefit package costs $28,000 that the company pays, and it results in this percentage in addition to your pay. So there's a lot of other values, of course, by tracking this and really showing that to the employees that they're valued. This is probably our most personalized report that we have within the HRMS, because employers and organizations like to personalize this with their value statement, their logo, and those kind of things. Definitely encourage you, if you're not doing this, if you have HRMS today and you're not giving them one, definitely reach out to your Tandem rep and talk about that, because that's something that we should definitely encourage. So let's talk about that next step. We have, now that we've kind of audited the system, we've showed you where the actual system information comes from. Let's talk about the new compliance to it, that My Workforce Analyzer part. Again, as I mentioned, it's just an additional module right within Sage HRMS. So literally, if you're a gold customer, you can request your license key, and you'll have it. You'll be able to have your My Workforce Analyzer link here. And like I said, Tandem can walk you through, adding that, making sure your system's set up correctly, and those kind of information. But basically, what they'll do is they're going to guide you through, your company information, your different benefit plans, whatever you've called them. Again, these are just my demonstration system, so I've called my plans what I think they should be. Yours may look totally different. They're going to guide you through your different IRS Section 490, 4980, IRS Safe Harbor codes, the associated one. Just walk you through regulatory periods, your measurement start, measurement end, your different earnings, if you have payroll, so the actual earnings methodologies with that, different job titles that are actually associated for salaried employees. If you have, one of the things they can get into is if you have employees that are certain employee types that are not full-time, you can associate those here as well. So it makes it easy to break down those. And then just overall ACA settings. The point of the system is when we actually go to run this and generate the data, it's going to utilize all of those all the information we previously talked about, dependents, beneficiaries, everything associated to generate those ACA forms. So what you'll literally do is when it comes time, or even before, for instance, if you wanted to test run this, you can run this process as many times you like just to see what kind of data, of course, we can generate or how things are looking, so on and so forth. When you go to generate forms, you can, of course, pick the year that's going to be associated with. If you are multi-employer, you can, of course, pick the company or the organization, the federal EIN that you want to associate it with that. Walks you through the wizard. Remember, it'll select your offerage of coverage code, which you can look up, your different safe harbor codes. And if you provided self-insurance coverage, you can check this box here as well. If you do have, of course, the HR, it'll pull it directly, the dependents and beneficiaries directly from the HR software. If you're using payroll only, of course, you'll have to import those in. But this is being the main effect of having the HRMS is all of this data will be tracked through the system, and you can easily utilize this. It's going to pull the data, and it'll show you a count of the forms we're about to generate here. So as I mentioned before, I'm picking one employer here. I'm picking those employees associated with my employer, my federal EIN, and it's just giving me a total. So I, of course, have one 1094, and then I'm going to generate for this, for my fake company, I'm going to generate 38 1095Cs for this particular setup here. It's going to go through, and I can, of course, spot check some of the things where our developers, they tried to make this look like the 1094 and the 1095, as you can see. Be able to go through and see that. As you can see, the 1094C has that listed here, Part 1, Part 2, Part 3, so you can spot check, the different coverage levels. All right. 1095, same way. If you wanted to walk through and spot check some of the employees, each one of them, you can simply click on these. This is what our developers refer to the Wysiwyg, or what you see is what you get. Wanted to make it look very similar to form so it wasn't difficult to see, okay, this box actually goes on this box on the form. Very simple as you go through. Okay. And walk through. And then, of course, you can even spot check, okay, did the dependents show up for Veronica Bell? Oh, here they are. Absolutely. Great. So we can show that. When you hit save, it's going to go through, and it should give us, let's see here. Let me back out of this. I think I might have mistaken it for 1 second. Confused it. There we go. It's going to walk us through. They'll generate the forms. Oh, and that is why, because someone has deleted my EIN. So let's put in a fake EIN here and hope the IRS doesn't knock on my door. And you can either print those immediately, or if we want to edit them out, we can do that. We'll go ahead and print these. it'll generate those forms. So just like with any, if you're familiar with any of the Sage HRMS payroll forms, it'll also tell us if we need an update. Those will be available in the quarterly updates. And it will open up an area where we can also view these forms in PDF if we want to print them. Okay, so let's go ahead and let's just open up, first of all, we'll open up a 1094. The one basically with our company information on it. Okay. All right. So basically it'll fill in any data associated with that, our company name, street address, city and town, any of the additional Part 2, Part 3 information that was set up within our system. So no surprises there. It'll walk through, fill those out, make sure those are part of the form. Again, if we need to spot check those or if you need to make a last-minute edit here, you can do that. But, of course, the whole purpose of the solution is to obviously be able to generate these and not have to do the manual entry. Okay. Next one. Let's open up a 1095C. And I think, if I remember right, this one kind of gives us this one gives us a little bit more of an advanced look. This is where the 1095 is fun. And when I am using fun very sarcastically, as you can see, John Craig has quite a number of covered individuals, but in this particular case, the HR department kind of lucked out because his dependents and himself were offered coverage all 12 months, so they could check that box. But for those of you that have those employees that, again, didn't follow a complete yearly cycle of coverage, then that's where it would have to fill in each one of these items. Or, without a solution, you have to do this manually for each one of these boxes. So it gives you an idea of some of the data that we have to put together. And again, you can generate these forms and either print them out, hand them out to your employees, or we'll also have an e-file offering through our provider. If those of you that are familiar with Atrix, they do some of the payroll tax filing information. So your yearly and quarterly tax filings. For those of you that use Atrix for Sage HRMS payroll, Sage 300 payroll, it will also do your W-2s. So for instance, if you're familiar with it, because of the W-2s, they can mail They can actually mail a copy of the W-2, and in this case, the 1095-C to your employees, as well as e-file those, in addition to keeping these on a secure portal that the employees can view, because we all know that, I'm sure many of you have probably heard of the situations where I didn't receive my W-2. I don't know what happened, and even though they've probably received one 3 times and it's happened, this is going to be another situation kind of like that, where we're required to supply an employer or an employee this information, and it's a matter of making sure they can get it in their hands. Okay. So really, when it comes to the entire product, of course, you can back these up. You can rerun this if we needed to spot check them, rerun them again, or we're running them, for instance, immediately after the year end, and then, we need to wait right before a final push. You can run this as many times as you like. That's what makes the nice thing about, of course, the actual My Workforce Analyzer. Allows you the ability to do that. One of the other things that, of course, we talked about previously is also the data dashboards. And the data dashboards, what they're going to do is it's going to actually take your data and analyze the information for you. So, what you have in the system. It gives you some dashboards of what's going on. It takes a second to run. Go ahead and let that run here. But it's going to give you those abilities I was speaking about before, that pay-or-play modeling, the full-time equivalency setup, and the actual full-time equivalency layout, whether you're a large employer, where you're hovering on that line of large employer status. Again, for those of you that know, hey, I'm a large employer, that's great, but it'll actually give you your real count. So if that's something that you're interested in, you can literally see what your real count is. You might know, okay, well, we're 250 employees ish. I know around, but what is our count? Those kind of situations. Okay, so just gives you a nice layout. Again, of course, what your large employer determination is for each one. You can, of course, look at nice little layout windows. You can look at the actual totals for each month that are occurring right here. They'll show you what your measurement period, your stability period is. It just breaks down each one of these. Also what I think the developers did a great job, each one of these little windows, if you click the help symbol, it'll take you to a learn more section, and they really have done a great job of trying to show exactly what the offering is, what the actual law states, that particular portion of the solution, what we're looking, how we're analyzing those numbers, and you can actually see each one. So I thought they did a great job of explaining each dashboard and what's going on. Again, the pay or play modeling, you can factor in, well, what's our employee contribution? What's the employer contribution? Where do we look at as far as a penalty? Those are types of situations that, many of you probably have already, by speaking to people, many of you have probably already determined this information. But if you're ever looking in the future, you can kind of see if we're looking to optimize our contribution, where do we stand with that? And, of course, the employee information. So, what employee contributions are, okay, what the employer contributions are, and you can see it, you can flag active, terminated, all employees. You can see from an affordability standpoint, did they have affordable coverage for each month? Okay. And you can see any of the employees that, receiving their subsidized coverage through a healthcare exchange. So if you have any of those on the plan as well, you can do that. So the dashboards were really just designed to give you that additional help with that payroll information. So, well, as I mentioned before, if you have Sage Payroll, these are things that we can, it obviously will take into consideration with the actual payroll. If you really are interested in some of the dashboarding as well, we do have formats that you can import this data in. So, that's not a problem at all. Just wanted to, I would definitely encourage you, if that's the case, reach out to your contact at Tandem, and we can definitely discuss that in addition. Okay. So from a workforce analyzer standpoint, we wanted to recap. Talked about the law. We talked about the actual history of it. Find it great that today was a day that I think Linda picked the perfect day to talk about it with the news coming out today. And really we talked about how Sage is invested in this. Obviously there's going to be additional investment from Sage into this as well as the laws continue to change. Different things are updated, different codes and feature sets and forms throughout the years. So we are committed to being there for you with this throughout the whole period of time. And then again, we also wanted to mention again, we have the tools here for you. So please jot these down. Reach out to Tandem. These are here for you. SageCanHelp.com. We put some links. The IRS actually has a decent portal out there explaining some of the different pieces of the law, but that's why we made our own portal as well, SageCanHelp.com, to really to help our customers and what it means, and tell them about dates that we feel are important, that should be evangelized out there to our entire base. Different reporting requirements, and we even have a healthcare benefits explained section as well. So really right now, I'm going to turn it back over to Linda and questions. And from here, just wanted to say thank you for everyone for taking their time, and definitely thank you to Tandem for taking the time and hosting this today. I can't tell you how much I appreciate everyone at Tandem for doing that.
Well, thank you, Scott. And we did have a couple of questions that I got through the chat. One of the questions is, we have a couple of clients that seem to be interested in knowing more about what the Sage HRMS team is going to be presenting at the Sage Summit in New Orleans.
Okay. Yeah. So, from an HRMS perspective, actually, I'll be involved in in one session on compliance where we'll be talking about the ACA a little bit further as well, in addition to all the other modules. So it's pretty exciting, from that perspective. One of the like I said, one of the sessions we're absolutely going to have, in addition to HRMS, pretty much all the different teams, speak on that. Some of the other things that we're going to talk about, of course, is how you can get started with an HRMS. That's another session that we're going to have. For those of you that haven't started or feel like maybe it really wasn't one of those things that you dedicated a lot of time to, that's okay. But what we're trying to show is, obviously, because of some of these compliance risks, in today's day and age, we really can't just go by the wayside and rely on Excel or even paper files or just kind of pseudo using an HR. We want you to really use HRMS and use it to the fullest, so you, not only for compliance reasons, but also because of your employee life cycle. Employees are so valuable today, and that's one of the things that I always like to ask. If you ask a CFO, a CEO, what their most valued asset in the organization, the great organizations, hands down, will answer our people. And it just makes sense to really follow your employees' life cycle and follow their actual needs and benefits and everything through a great HRMS process. So yeah, that's a great question, Linda.
All right. Excuse me. And then the next question I have is, what if we're a company that we're using ADP for our payroll services?
Yeah. Okay. So yeah, very good question. For those of you that do have that outsourced payroll and you're looking for that information, that's exactly why we designed it, to be able to import that payroll data, so you can get full use of the utility. We're going to need the HRMS for the actual process. So we want to have your benefits set up. That was the whole portion of the benefits set up, and that's why I really wanted to show you why that was so important from the HR side. Internally we we don't kind of joke, but it's funny because the HR is so key in keeping track of, again, your HR setup, the costs and coverage codes, and everything along those lines. But then the IRS actually mandated payroll as the individuals that they're going to knock on the door if they have to audit these 1094s and 1095s. So it really takes a cohesive process by both. And those of you that do have outsourced payroll, we do have those import formats that we can pull in your outsourced payroll data into the system. So definitely encourage you to reach out to Tandem, your rep at Tandem, and we can have a further discussion about that import process and when we can get that data in.
All right. Excuse me. Does anyone else have any questions? Well, Scott, I think you've done such a good job that we're done.
Well, great. Well, and I think I kind of lied. I said I was going to take the full hour, but I think we kind of did. So, again, I just want to thank everybody. If you are at Sage Summit, feel free to come up to the HRMS booth. We can definitely talk about it further. I know everyone has individual needs, and Linda, thank you so much for your time today and hosting this.
Right, and Scott, thank you, and more importantly, thank you to our clients that have taken the time out of their day to learn more about this Affordable Care Act and how not only Sage can help, but how Tandem can help. So I think with that said, I'm going